Here we go. All right. Hope everyone is doing well. Thanks for sitting in. We're going to get started because we have a lot to do. We had a fantastic response for this webinar. About 100 practitioners signed up for it. Some are here today. Some will get the recorded version. So I called this webinar um, Update on Glucosamine Research, Vital Studies that all chiropractors should know about. And of course, you should never end a sentence with a preposition, but I did anyway, just to emphasize, I think, the importance of what I'm going to go through. So thanks for sitting in. Let's get started. So a lot of what we'll talk about initially is osteoarthritis. And so I just want to remind you what medical doctors are facing in terms of managing osteoarthritis. In terms of non-steroidal anti-inflammatory drugs, aspirin, Voltaren, ibuprofen, indomethacin, all these drugs, they're told to use them very cautiously or not at all in people that have liver or kidney damage. And a lot of older people that have osteoarthritis often have compromised liver function, but they almost all of them have a decline in kidney function. People with high blood pressure, people with a history of heart failure, history of ulcers, gastritis, any gastric erosion. We know that these drugs cause internal bleeding and death in thousands of people every year. So most older people with osteoarthritis have at least one of these contraindications. So they can't just use these drugs, indiscriminately and just ongoing without any concern. Acetaminophen is the same thing. It's the leading cause of drug-induced liver failure. People with any history of liver disease, people that combine alcohol with the intake of these medications often run into trouble if they're already taking a lot of other drugs that are challenging the liver for detoxification. Acetaminophen is more likely to do damage. So you can't just take this just on an ongoing basis, without any concern. There's great concern with these drugs. They cause liver failure and all kinds of adverse side effects every year for thousands of people. And of course, the opioid solution never became a solution. It became a crisis, not a solution. So medical doctors are actually out of really good options in conventional treatment. And that's why what I'm going to present to you, I think, is really something to drill down on and take seriously. So over and above our great hands-on skills as chiropractors, on a biochemical level, what's going on in the joint cartilage and the joint tissue requires certain nutrients and chemicals that help to preserve cartilage and maintain joint structure and function. So we're going to talk about glucosamine today as one of those things. And osteoarthritis, of course, it's a common problem as people age. It's the leading cause of age-related disability. And almost everybody becomes affected over time. That doesn't necessarily have to be the case, as we'll talk about. There's an aging process that leads into this, and certain people genetically have a greater risk, of course. A few points before we begin, that is to talk about the synovium that wraps around these joints and synovial fluid. It serves some very important functions because cartilage is avascular. The nutrients that flow to the cartilage and the chondrocytes in the cartilage flow there through diffusion through the synovium. The synovial fluid is a very important aspect of joint health. The synovial cells synthesize lubricants like hyaluronic acid, as well as collagen and fibronectin, which form an important part of the synovial interstitium. In the synovial lining, the primary cell populations are fibroblasts and macrophages. So in cartilage, chondrocytes are the main cells. But in the synovial tissue, fibroblasts and macrophages are key cells, and they factor into the inflammatory process and the destruction of joint cartilage, as you're going to see if things go awry. So here's that picture of the avascular cartilage and the synovium, the synovial fluid, allowing nutrients to diffuse to the chondrocytes, so the chondrocytes can get oxygen and glucose and glucosamine and other things that they can use to help build cartilage and stay healthy. Chondrocytes are living cells. They use aerobic and anaerobic metabolism to stay alive. And so they're a viable cell. And you'll see what happens in cartilage over time that leads to cartilage erosion. So there's 5 key areas where nutritional medicine can help play a role in the management of osteoarthritis. One of them is supporting the synthesis and slowing the breakdown of articular cartilage. We're going to spend a lot of time there today. Also, decreasing the synthesis of pro-inflammatory prostaglandins and cytokines, helping to balance immune system functions so it doesn't start producing too many inflammatory cytokines. Weight management is important because fat cells, when they become larger, secrete cytokines that promote more inflammatory damage and also more weight-bearing stress on the joints. And exercise is really fundamentally important, as you can appreciate. So over and above chiropractic treatment, these things become really key. And as I've gotten older, I've realized the importance of doing stretching in a swimming pool where you're less weight bearing. You know, you have this buoyancy. And so you can stand on one leg and do all kinds of things and lean way back. And because of the buoyancy of the water, you can get tremendous increase in range of motion that I personally can't get stretching on land. It really has helped me specifically. So just thought I'd mention that. You probably know that already. What's important to us today is that there's an age-related decline in the synthesis of proteoglycans in the joint cartilage. So around age 40, chondrocytes, which are the only viable cells in cartilage, they slow the production of chondroitin sulfate, which is a key component of joint cartilage, which I know you know. As such, the breakdown of chondroitin sulfate now starts to surpass the synthesis. And so you start to get joint cartilage erosion. You see joint space narrowing on X-ray, and all those signs of osteoarthritis start to show up. Joint cartilage is also further speeded up in the presence of inflammatory prostaglandins, prostaglandin series 2 in particular, and also matrix metalloproteinases. This is secreted by fibroblasts-like cells in the synovium. When they're secreting this MMP, it's like a drill going through cement. It's actually destroying the joint cartilage with these proteinases that actually cause destruction of the collagen and elastin fibers inside the cartilage, making everything worse. The fibroblast-like synovial cells also decrease the synthesis of hyaluronic acid with age. So as you get older, you're making less hyaluronic acid, which helps with the viscosity of the joint synovial fluid to have a more shock absorbing capacity when you have more hyaluronic acid. So you're running out of chondroitin sulfate. You're often increasing more prostaglandin synthesis of the pro-inflammatory type and more of the matrix metalloproteinases. All these things that factor into joint cartilage destruction, less viscosity, less weight-bearing capability. So we start to get joint cartilage erosion in the articular cartilage, especially of weight-bearing joints, and you see the effects on X-ray. You say, where did all those changes come from? It comes from the things we're going to talk about today. So what's unique about chondrocytes and fibroblasts is that, of course, glucose can get into those cells. So remember that it's diffusing, in this case, through the synovial fluids, right? Glucose. But once glucose gets into the chondrocytes, it can be used as a source of energy. It can be used to build the backbone of DNA and RNA. But what's unique is that it can go through the hexosamine biosynthetic pathway. That's what's unique to these cells. And from there, you can start to form chondroitin sulfate and hyaluronic acid and other proteoglycans that the body uses. So when you look at how chondroitin sulfate is formed, it requires glucosamine. So what the chondrocytes can do is they can take glucosamine that you see here. I'm trying to find my mouse. And glucosamine goes along this pathway to form glucosamine 6-phosphate. And it's this big enzyme step right here, the fructose amide transferase enzyme. As we get older in the body's biological aging clock, that enzyme becomes more sluggish. It drops off as there's less concentrations of it. So we convert less glucose into glucosamine as we get older. And then once you have the glucosamine 6-phosphate, it gets converted into, oh, what did I do? Sorry. Let's come back. That's what I want to show you. So glucosamine 6-phosphate gets converted into N-acetylglucosamine 6-phosphate. And from there, an N-acetylglucosamine can then form hyaluronic acid, right? So fibroblasts can do that inside the synovial tissue to make more hyaluronic acid to maintain joint viscosity. But some of the N-acetylglucosamine becomes N-acetylgalactosamine, and that's what you need to make chondroitin sulfate. So chondroitin is really repeating units of glucuronic acid and N-acetylgalactosamine attached together. And what it does is that's the repeating disaccharide. It forms this very long oligomer or polysaccharide. So you get this long thing that's called chondroitin sulfate. And it's chondroitin sulfate that's made from glucosamine originally that is required for joint cartilage. So chondroitin sulfate is repeating chains of these two monosaccharides, glucuronic acid and N-acetylgalactosamine. But you need glucosamine to make N-acetylgalactosamine. As you get older, the chondrocytes don't make glucosamine that well. But if you can get glucosamine into the chondrocyte through supplementation, it can start making chondroitin sulfate again. That's the principle here. Chondroitin sulfate is like the mortar between the bricks inside cartilage, where the bricks are sort of collagen and elastin fibers, but between the bricks, you have all this chondroitin sulfate. It has like a bottle brush appearance, which I'm going to show you right here. You've seen this before, I think, where you have like the serine residue. And here's the chondroitin sulfate, these like bristles on a brush. And so if all of a sudden you can't make chondroitin sulfate anymore, then the collagen and elastin fibers start getting closer together and you get joint space narrowing. Now, the other thing is that chondroitin sulfate also attracts water to hydrate the cartilage. So as the cartilage is disappearing, because you have less chondroitin sulfate and it's thinning out, you're also losing water content, and that makes the cartilage more brittle, and that's why cartilage tends to chip and break, and you get a joint mouse and all these things that can, the meniscus breaks, and you have all of these problems with the cartilage. It's not just thinning, but it's becoming brittle. So we run into this situation of cartilage erosion as we age unless we do something about it. So the thing that you can do about it, the one thing you can do about it for sure, is start to give your body the glucosamine that it didn't get, that it's not making for itself anymore. So over the years, there have been all kinds of studies showing that when you take a glucosamine supplement, up to 98% of it gets absorbed. 26% of it then survives the first pass through the liver. Whereas when you take a chondroitin sulfate, it's such a large molecule, it really can't get absorbed from the gut into the bloodstream very well. Some studies show 0% absorption. Some show only 13% absorption, which is very poor. So I would leave chondroitin sulfate out of the supplement, which I have done personally. There have been many studies looking at glucosamine. I'm going to show you the most recent ones. It's used in over 70 countries around the world to help manage osteoarthritis, but there's some new applications for it that I'm going to show you today. So to sort of summarize the studies that we've seen, we overall, as I'm going to prove to you, glucosamine slows down or halts cartilage erosion, may help to actually increase it to some degree. It reduces pain and swelling by suppressing inflammatory cytokines and suppressing the release of prostaglandin series 2. It increases hyaluronic acid synthesis by the fibroblasts, increasing joint viscosity. It also increases collagen synthesis. Now, exercise also does that, but there's some evidence that glucosamine can do it. In head-to-head studies against non-steroidal anti-inflammatory drugs and PRP, platelet-rich plasma, as I'm going to show you, you see that glucosamine, after a 12-week period, is giving you the same benefit as those drugs and procedures, much less frequent side effects than the drugs, and the side effects are much less severe. So I've shown you this before. This is from the Therapeutic Advances in Musculoskeletal Disease in 2012, when they said, you know, glucosamine is this drug or supplement that's been used for osteoarthritis. In Italy, it's a drug, in some other countries as well. It's known for its cartilage building ability. But what's not appreciated as much is that it actually inhibits the release of inflammatory cytokines like nuclear factor kappa beta in interleukin-1. This is critically important. This is where inflammation comes from, not just the kind of inflammation that causes joint cartilage problems, but in the blood vessel wall, and also promoting the development of cancer. As you're going to see, all these things dovetail and point back to nuclear factor kappa beta and interleukin-1. I'll show that to you momentarily. It's been used to manage osteoarthritis successfully in many trials. The form of glucosamine that is best is glucosamine sulfate. Everyone agrees on that. The dose is 1,500 milligrams once a day. Improvement of pain and function. Has these great symptom modifying effects, especially in knee osteoarthritis. Continuous administration of up to 3 years resulted in significant reduction in the progression of joint structure changes. That means it stopped joint space narrowing compared to placebo. And that was seen on radiographic studies. That was the Register study. I forget what year it was, published in the New England Journal of Medicine. So the two effects of the disease-modifying effects have been shown to even help reduce the likelihood a person will need joint replacement therapy if they take this for 12 months or longer. Very safe drug to take. It's glucosamine sulfate that is the gold standard winner of all the glucosamine formulations out there. There's other forms. The glucosamine sulfate increases the plasma synovial fluid concentrations of glucosamine better than any other form. So let's look at nuclear factor kappa beta here for a second. So here you see a cell. This can be any cell in the body, but let's say for our purposes right now, it's a fibroblast or a chondrocyte. Here's nuclear factor kappa beta in the cytoplasm. It's normally sitting there sequestered by the inhibitor of nuclear factor kappa beta. But upon stimulation, nuclear factor kappa beta translocates to the nucleus of the cell, and it upregulates genes that turn on proliferation and inflammation. So here you see, for instance, where there's macrophages that are promoting inflammation, they release tumor necrosis factor alpha. This happens a lot in autoimmune diseases, but to some degree also in osteoarthritis. And tumor necrosis factor alpha stimulates these receptors, and then down through nuclear factor kappa beta, it releases it, and it goes to the genes in the cell to promote inflammation and rapid cell division. Now, let's look at it again. Here's nuclear factor kappa beta going to the nucleus and upregulating what? The activity of cyclooxygenase to make more prostaglandin series 2, which is inflammatory, and increasing more tumor necrosis factor alpha, which then comes back and re-stimulates everything. So nuclear factor kappa beta continuously is upregulated. It increases interleukin-1 and interleukin-6, which also keep promoting more inflammation and pain, and even inflammation in the blood vessel wall. And it upregulates monocyte chemotaxis protein, the MCP, which brings more activated macrophages to the site, which then release more tumor necrosis factor alpha, and you get this vicious cycle that doesn't stop. And it all begins with tumor necrosis factor alpha being released from the cytoplasm, going to the nucleus and upregulating these genes. So they said, well, let's do a study on human osteoarthritic chondrocytes. And they said, let's expose those human osteoarthritic chondrocyte cells to interleukin-1, which we know will stimulate a massive release of nuclear factor kappa beta. And let's see if glucosamine can block the release of nuclear factor kappa beta under those circumstances. And it can. So glucosamine inhibits the synthesis of pro-inflammatory mediators, and human osteoarthritic chondrocytes stimulated by interleukin-1 through a nuclear factor kappa beta dependent mechanism. That means it tamps down the release of nuclear factor kappa beta. Our study further supports the role of glucosamine as a symptom and structure modifying drug in the treatment of osteoarthritis. This is huge. So then in 2019, in the journal Aging and Clinical Experimental Research, they said using a new model to simulate individual healthy utility scores of patients, including 10 published trials, analysis showed that the use of glucosamine sulfate is cost-effective, while other formulations were not. Chondroitin supplements may be a waste of money because they don't get absorbed. In April 2019, Seminars on Arthritis and Rheumatism, here's what they wrote. Glucosamine sulfate shows evidence for disease-modifying effects, reduction in need for concomitant OA medications. That means using less non-steroidal anti-inflammatory drugs and acetaminophen, and a delay in the need for total joint replacement surgery. In a new network meta-analysis looking at studies over 1 year, only glucosamine sulfate had a disease-modifying profile, being consistently effective on knee osteoarthritic pain, physical function, right, even functionality and joint structure changes. Glucosamine improves symptoms in patients suffering from rheumatoid arthritis, right? This is a study in 2006 in the Rheumatology International. This double-blind placebo-controlled study showed a remarkable a remarkable decrease in pain and swelling associated with rheumatic arthritis when glucosamine was used at a dose of 1,500 milligrams a day. It makes sense. If you can block the release of nuclear factor kappa beta, that's what's causing a lot of the inflammatory response in autoimmune diseases that affect the joints. And you're getting this cartilage sparing effect on chondroitin sulfate, because there's a lot of joint cartilage erosion in rheumatoid arthritis. So now here's what's new that I haven't showed you before. This is in 2023, a systematic review of all the glucosamine studies looking at osteoarthritis. So the primary goal of our systematic review was to evaluate the effectiveness and safety of glucosamine based on recent studies. Electronic databases of PubMed and Scopus and Cochrane were all used to assess the randomized controlled trials from the very beginning of where all the studies began back in the 80s of glucosamine right through to March of 2023. As long as the papers fulfilled the inclusion criteria, where you could get a reliable outcome looking at the Western Ontario McMaster University Osteoarthritis Index, the WOMAC, and also the visual analog scale. If it met this inclusion criteria where they found satisfactory methodology in the research, then the 15 studies that they allowed in were selected. What they said is that global pain was significantly decreased in comparison to placebo in the groups that used the glucosamine as measured on the visual analog scale. They also said the WOMAC scale confirmed that pain, stiffness, and physical function improved when you combine the evidence from all 15 of the most reliable studies that have been undertaken to date. Yet they'd also revealed there were no reports of serious medication interactions or significant adverse events. It makes glucosamine very, very safe. They said, and these are their words now, to summarize, glucosamine is more effective than a placebo at reducing pain and knee osteoarthritis. In long-term treatment, oral glucosamine sulfate, 1,500 milligrams a day, is believed to be well tolerated. In the body of the paper, they said, analgesia, which includes the use of like acetaminophen and topical and oral non-steroidal anti-inflammatory drugs and opioid medications and hyaluronic acid injections, they continue to be the cornerstone of sort of medical treatment. Nevertheless, they are accused of escalating the likelihood of unfavorable occurrences in the gastrointestinal and cardiovascular system as they solely concentrate on symptomatic relief rather than curing the sickness. This is why, and here's what they're saying, this is why symptomatic slow-acting drugs, which can alleviate the clinical symptoms of osteoarthritis with superior tolerance and safety profiles, have made waves. One of these is glucosamine, a natural substance that ranks among the body's most common monosaccharides. For more than 50 years, it has been used as a medication to treat OA. Most scientific societies in Europe, but not the United States, where you have pharmaceutical influence that's so strong it suppresses this message, suggest glucosamine for the treatment of knee problems. What about side effects? Here's what they say. Using oral glucosamine at 1,500 milligrams a day there's no significant difference in the frequency of the adverse effects compared to placebo. In fact, the groups using the placebo had more side effects. According to most adverse events affected in terms of, they affect the gastrointestinal tract. Some abdominal pain, diarrhea, and dyspepsia. But if you take glucosamine with food, usually that doesn't happen. There were no serious adverse events in studies looking at use for 3 months, and using glucosamine for 2 to 3 years, there were still no serious adverse events occurring. What about drug-nutrient interactions? This is what they say. Glucosamine has no serious drug interactions. However, and this is important, Using warfarin and glucosamine together may boost the anticoagulant impact, according to several studies. So I'll comment on this in a moment. It may also interfere slightly with diabetic drugs. If patients are currently using diabetic drugs, warfarin, they should inform their doctor to help monitor if glucosamine is having a negative impact. So here's how it should play out clinically for you. Understand that for some people, glucosamine can cause some GI upset, drowsiness, skin reaction, headaches. These things have all been reported. Not frequent, but you should know it can happen. A couple of reports of raising blood pressure. So if a person has high blood pressure, you want to monitor that for the first couple of weeks. It may create some insulin resistance in some people. So if they're a diabetic or pre-diabetic, you want to help make sure they monitor their blood glucose in the early stages of taking glucosamine. There was one report of tachycardia, but they don't know if it was glucosamine or if it was chondroitin. That's very unlikely to happen. But these side effects are minor compared to what you get with non-steroidal anti-inflammatory drugs: internal bleeding, congestive heart failure, liver and kidney toxicity. Other concerns: some patients think they can't take glucosamine sulfate because it contains sulfa, but it doesn't contain sulfa. It contains the mineral sulfur, and no one can be allergic to sulfur. Sulfa compounds, the sulfamides, are something totally different than the mineral sulfur. People with sulfa allergies can take glucosamine sulfate. Because glucosamine is mined from the exoskeleton of shellfish, but it's sort of pure pharmaceutical grade, they say that people with shellfish allergies can take glucosamine, but honestly, I've seen some people react to glucosamine when they had seafood or shellfish allergies. So I tend to encourage them not to use glucosamine. If the person's a diabetic, you want to monitor their blood sugar for the first few weeks. Same with high blood pressure patients. If they're taking any anticoagulants at all, warfarin, Coumadin, Plavix, I would suggest that they make sure that they're getting their INR monitored, that prothrombin time, for the first few weeks when they start glucosamine. So they can take glucosamine, but you just want to monitor these things to make sure it's not producing an adverse effect for those individuals. What about, so more recently, we've seen that a lot of people go for PRP injections into their joints. This is platelet-rich plasma. Platelets contain these sort of growth factors that can help to stimulate the regrowth of some cartilage. So in this study, published in 2024, they compared the functional performance outcomes from baseline to a 1-year follow-up between glucosamine sulfate supplementation and PRP injections in people with knee osteoarthritis. 382 patients receiving glucosamine orally and 122 patients who underwent PRP injections were enrolled for a review of functional performance outcomes, including, and this is how they assessed it, they looked at what's called the 5-time sit and stand test, the time up and go test, and the 3-minute walk distance test. The patients were followed for 1 year. What they said is, although the PRP patients showed faster improvement in some of these parameters, by 12 weeks and up to 1 year, there was no difference. The people who were taking glucosamine or the group that got the PRP really showed the same amount of significant improvement in all of these test outcomes. So as they say, as the use of PRP is more complicated and invasive than the use of glucosamine, the benefits and drawbacks of selecting PRP over glucosamine in knee osteoarthritis treatment should be examined. What they're saying is, it looks like over the course of, once you get to the 12-week point, and certainly up to the 1-year point, the use of glucosamine is giving you the same effect as PRP injections. What patients don't appreciate is that sometimes it takes 3 months of glucosamine use to start to actually see the benefit. For some people, it takes up to 6 months or a year. So you have to encourage people to stay with glucosamine. Once they get on it, it's not like, in 1 week or 2 weeks, even in a month, that they're necessarily going to start to see improve. But over time, it helps to suppress inflammation, stabilize joint cartilage, and give them better functionality. That's the overall message for people that have mild to moderate osteoarthritis. Once it's really advanced, they need knee replacement therapy or replacement or hip replacement. It's too late. But for mild to moderate cases, glucosamine shows the very same benefit as PRP. PRP is really expensive, by the way, and glucosamine is very inexpensive. Now, what I want to bring your attention to now are things you probably haven't seen. These are the secondary benefits of glucosamine supplementation that's emerging in the research, looking at studies on healthy life expectancy and extending lifespan, reducing cancer risk, reducing all-cause mortality, reducing risk of heart disease. So I think you're going to be blown away by this. So the report started back in around 2019 to 2021. Here it is in the Journal of Human Nutrition and Metabolism. What they say is glucosamine supplementation is now showing potential as a very important anti-aging drug. This stems from the fact that the administration of glucosamine not only supports joint cartilage, but at the cellular level, it's involved in many processes shown to extend lifespan and reduce risk of some chronic degenerative diseases. One human observational study, which was the UK Biobank study, showed that individuals who took glucosamine supplements showed a 17% lower risk of total mortality compared to non-glucosamine users. And a 2020 study of 490,000 individuals showed that glucosamine supplementation was associated with reduced risk of cancer, heart disease, respiratory disease, digestive disease, and mortality compared to non-glucosamine users. These observations were strengthened by recent animal studies. Since the year 2014, two animal experiments showed that lifespan of mice and earthworms were extended with oral administration of glucosamine. Don't laugh at that, because when they start looking at drugs that can extend lifespan and other agents, the first place they look are at mice and nematode models, because it carries a lot of weight. There's a lot of similarity between our genes and the genes of mice and nematodes. In the 2014 mouse experiment, data showed the average lifespan extension was 10%. In nematodes, life expectancy increased by 30% with glucosamine administration. A life extension of 10 to 30% in these animal models is considered to be very important by the scientific community, actually. Here you see the life extension graph here in the mouse model. So the red lines are showing the life extension in mice that got the glucosamine versus the ones that didn't. So now in 2020, a published paper in the Annals of Rheumatology showed that regular use of glucosamine supplements was associated with a significant reduced risk of dying from cancer, cardiovascular disease, respiratory diseases, diseases of the intestinal tract, as well as reducing all-cause mortality by 15% compared to non-users of glucosamine. This was the UK Biobank study, following around 500,000 people. In November of 2022, an update of the UK Biobank study was published in the Frontiers of Nutrition, which focused on glucosamine's potential protective role against cancer. The UK Biobank study is one of the largest population studies in the world, whose stated aim is to improve the prevention, diagnosis, and treatment of various diseases, as well as promote health across society. The study originally included over 500,000 participants, ages 38 to 73 years of age. They entered the study in 2006, 2010. They've been followed up to March 2021 as of this report. The study showed that after controlling for other cancer risk factors, individuals who routinely took glucosamine supplements showed a significant decrease in overall cancer risk by 5%, a 32% lower risk of kidney cancer mortality, 16% lower risk of lung cancer mortality, and a 24% lower risk of rectal cancer mortality. As the researchers pointed out, in addition to supporting joint cartilage in the prevention and management of arthritic conditions, glucosamine also has shown important anti-cancer properties in experimental animal studies. So how might glucosamine reduce cancer risk? This is the experimental research. Glucosamine is shown to inhibit the proliferation of many types of human cancer cells. It also induces programmed cell death or apoptosis of many types of human cancer cells. I'll show you some of these studies. Glucosamine is also shown to reverse tumor drug resistance. In other words, when you apply glucosamine, it tends to make cancer drugs work better, whereas before they were building up resistance to the chemo drugs. Now they become responsive to the chemo drugs again, and it kills more tumor cells. It also stops their ability from forming new blood vessels, which we call angiogenesis. It's an important way to stop metastasis. It also inhibits matrix metalloproteinases, which cancer cells use to drill holes to go from one tissue to the next in terms of direct metastasis to an adjacent tissue. As the researchers point out, several epidemiological studies have indicated that glucosamine is connected to reduce cancer mortality in the US and the UK. In some studies, a reduction in overall cancer risk of 15% has been documented. And here's the research paper if you want to go and read that. So you look at nuclear. So because glucosamine inhibits nuclear factor kappa beta, when you look at cancer and nuclear factor kappa beta, the release of nuclear factor kappa beta tends to encourage cell survival rather than program cell death of cancer cells. It increases proliferation, so cells are dividing faster. It affects the immune response in a way that favors the immune cells can't attack the cancer cell. It encourages angiogenesis, so cancer cells make more blood vessels, and it increases metastasis. So down regulating nuclear factor kappa beta is hugely important, and that's one of the main things that glucosamine does. They're trying to make drugs that can do this. So in Molecular Mechanisms of Anti-Cancer Effects of Glucosamine, published in Biomedicine and Pharmacotherapy in 2017, when they looked at the anti-cancer effects of glucosamine, they said, listen, way back in 1953, we saw early evidence that glucosamine could inhibit these sarcomas in mice. They said it didn't block the tumors completely, but it slowed down their cell division, and it doubled the survival time of the mice that were given the glucosamine. More recently, we've seen studies on glucosamine affecting or improving lung and colorectal cancer in terms of experimental studies and human epidemiological studies. So then so I thought I'd show you this as an example. So here you see a study published, Glucosamine Enhances Programmed Cell Death of Human Prostate Cancer Cells, published in 2019. So normally, what you want to have happen when a cancer cell is emerging is the caspase 8 enzymes come and cause the cancer cell to commit suicide, apoptosis, and suppresses the release of nuclear factor kappa beta, and you decrease cell survival. But what happens in cancer cells is they're able to increase nuclear factor kappa beta. They decrease the caspase enzyme system so the cells don't induce apoptosis and the cells survive. So they did studies where they said, if we give these cancer cells glucosamine, can we turn on this pathway? Yes, glucosamine, as you see here, turns on the pathway towards suppressing inflammation, suppressing nuclear factor kappa beta, increasing caspase-induced programmed cell death. And they said, not only that, but if we combine glucosamine with the trail, which is a sort of a cancer drug, it makes the trail effect much more impactful in terms of killing the cells. So glucosamine combined with chemo drugs showing a better effect. And so here's the effect of that pathway. So this is the same pathway. You're seeing it here. You come down through the trail pathway down to caspase 8. It affects caspase 3. And then you get the effect of caspase 3 releasing cytochrome C from the mitochondria. When that happens, the mitochondria break down, you form free radicals, and the cell undergoes apoptosis. So that's sort of what happens. So you want to, in cancer cells, turn that pathway on so the cell will commit suicide. What I'm saying is that glucosamine has been shown to do that in a number of human cancer cell lines. It also increases the signaling pathway called STAT3, which or inhibits STAT3 in many cancer cells, including human prostate cancer cells. I'll show you a picture of that right here. So in cancer cells, they often turn on the STAT3 signaling, it's called signal transduction pathway, where STAT3 goes to the nucleus, and it turns on cell survival, cell migration, so you have more metastasis and transformation of precancerous cells into cancerous cells. So you want to be able to, in cancer and precancerous cells, block STAT3. And what you see is that glucosamine, if we go back one slide, has been shown to do exactly that, and to suppress interleukin-6 production and STAT3 signaling, because these things all in cancer cells are very, very active. So this STAT3 coming to the nucleus turns on all the genes that cause the cancer cell to divide and thrive and metastasize. Glucosamine, by inhibiting STAT3, turns that mechanism off. So when you look at nuclear factor kappa beta and its role in inflammation, immunity, and cancer, you see when it's upregulated, it's increasing tumor cell proliferation, tumor cell survival, converting cancer stem cells into cancer cells, increasing cellular metabolism, increasing angiogenesis, more blood vessels so the cancer cells can spread more metastasis, suppressing the immune system and resisting cancer therapy. So anything that can suppress nuclear factor kappa beta is spectacular. And so glucosamine is one of the few things that does it consistently. You see all the effects of nuclear factor kappa beta encouraging cancer development and progression. And so we think that's why, one of the main reasons why taking glucosamine is associated with a reduction in cancer incidence across these large populations. Now, it's not just nuclear factor kappa beta that can suppress, it's not just glucosamine that can suppress nuclear factor kappa beta. Many natural things can do it, like curcumin, quercetin, resveratrol, EGCG from green tea, genistein, many polyphenols from food and supplements. The problem is their bioavailability is terrible. Curcumin is 1 to 2% bioavailability. Same with resveratrol, very low bioavailability. Whereas glucosamine, 98%, up to 98% of a dose of glucosamine gets absorbed. So you're getting physiological effects in the bloodstream and into tissues that can be meaningful. That's why you're seeing people using glucosamine supplements getting these effects. We also see in the Annals of Rheumatology Diseases in 2020, glucosamine use and reduced all-cause mortality, saying several previous studies have suggested glucosamine may help reduce risk of heart disease, cancer, some other common health problems, as we saw in the UK Biobank study, where the average age was 56 years old. The results showed that compared to individuals who are not taking glucosamine supplements each day, those who use glucosamine supplements daily experience what? Decrease in all-cause mortality by 15%, decrease in dying from cardiovascular disease 18%, decreased risk of cancer 6%, decreased risk of respiratory diseases 27%. That includes, by the way, age-related pulmonary fibrosis, which kills people as they get older, a decreased risk of dying from digestive and intestinal tract diseases by 26%. That's remarkable. The researchers state, our results are consistent with findings from several previous studies which indicate inverse association between glucosamine use and mortality. In the UK Biobank study, 19% of the population in that study used glucosamine supplements. This study showed that even smokers who use glucosamine had a lower risk of death from all causes than did smokers who were not using glucosamine. Unbelievable. The researchers explained their overall findings, saying that glucosamine supplements reduce the release of various inflammatory chemicals, signaling agents such as nuclear factor kappa beta and C-reactive protein. These things are important in the development of cardiovascular disease, respiratory diseases, intestinal diseases, including the esophagus, the stomach, the small intestine, and the large bowel. Glucosamine supplementation has also been shown to decrease the use of glucose as a fuel, mimicking the effects of a low carbohydrate diet. So in some cases, it helps to lower blood glucose levels, which of course is linked to better longevity. What they say is we observe that regular use of glucosamine supplements is associated with lower mortality due to all causes, cardiovascular disease, cancer, respiratory diseases, and digestive diseases. Glucosamine is not just about joint cartilage anymore. In 2019, in the British Medical Journal, they say, we see that glucosamine supplements may also reduce risk of death from heart attack and stroke by 22%. Researchers analyzed diet and lifestyle of almost 500,000 adults 40 to 69 years old. This, again, is the UK Biobank study, followed them for 7 years. They found that people who regularly took glucosamine supplements to reduce symptoms of pain and stiffness, because they're using it for arthritic conditions, were less likely to develop heart attack and stroke. It's unbelievable. After taking into account a wide range of variables, including age, gender, race, income, smoking, alcohol, body weight, physical activity, dietary factors, after they factored in that, including diabetes, high cholesterol, high blood pressure, they said glucosamine use alone is associated with a 22% reduced risk of dying from a heart attack or a stroke. That's unbelievable. And then in 2016, they sort of went on to sort of justify some of the molecular mechanisms suppressing nuclear factor kappa beta and inflammatory cytokines, as I said earlier. Glucosamine is doing all this. Look at this report in 2016 in Life Sciences. They're saying, look what glucosamine does. Suppresses inflammation, suppresses cancer growth, reduces cardiovascular disease, may help with by suppressing brain inflammation, suppressing inflammatories, may preserve kidney function, and because you need dermatin sulfate and other proteoglycans in the skin, it also preserves skin function and may help to remedy some skin disorders. So this takes me back to glucosamine supplementation. Of course, I put glucosamine into Adeeva glucosamine joint formula, but I put it in there with 3 natural anti-inflammatories, and they're important because studies show that MSM, quercetin, and bromelain all inhibit the production of prostaglandin series 2, which is part of the big feedback loop. So as you know, arachidonic acid forms prostaglandin series 2, which is pro-inflammatory, secreting a lot of prostaglandin series 2. Of course, omega-3 fats have the opposite effect. But in terms of arachidonic acid becoming prostaglandin series 2, this cyclooxygenase enzyme is what creates prostaglandin series 2 from this omega-6 fat, arachidonic acid, that's very high in the American diet and North American diet. So MSM and quercetin and bromelain, they all block this very important step, as do some other natural agents like, white willow bark and curcumin and ginger. They also do it. But in this product, you're getting MSM, quercetin, and bromelain. The reason it's there is to block cyclooxygenase so you don't make prostaglandin series 2, because prostaglandin series 2, once it's formed, stimulates cells to produce more nuclear factor kappa beta and start that whole inflammatory cycle. It's one of the stimulations that causes joint inflammation and encourages cells to become responsive to nuclear factor kappa beta that can encourage cancer development. So you want to block prostaglandin series 2, not just nuclear factor kappa beta. So those natural agents become important from that standpoint. So, of course, I think you should take Adeeva's Nature's Essential Oils to get more fish oil, borax sheet, and flaxseed oil to help make more prostaglandin series 1 and prostaglandin series 3 and suppress prostaglandin series 2. That's great. We also make Nature's Relief that has these other natural agents like curcumin, boswellia, white willow bark extract, and ginger. They also block prostaglandin series 2 production. But this is the foundation product because it has the glucosamine in it with the natural anti-inflammatory. And glucosamine is really emerging as not only something to protect joints and maintain functionality, but also it has anti-aging effects that are now very tangible. We understand how they work. It has these other overarching disease prevention effects that are starting to surface in the literature, both in human epidemiological studies, and the experimental research is very convincing. So I think this is critically important to get people onto a product like this and have them stay with it for the rest of their life, not just for 3 weeks, a month, 2 months. This is foundational. We see that in this book that was written called Molecular Nutrition in Chapter 19, where they talk about the beneficial effects of glucosamine. This is a recent publication. They're showing all the important effects of glucosamine. Let me just read this to you as we get to the end. Glucosamine is a well-known supplement for the treatment of osteoarthritis, has diverse biological and pharmacological effects, including anti-inflammatory, antioxidant, anti-aging, cardioprotective, chondroprotective, liver protective, and cytoprotective properties. Recently has received increased attention due to its potential health benefits, especially in treating inflammatory-mediated diseases such as cancer, atherosclerosis, neurological diseases, and skin disorders. Its most function appears to be mediated through the suppression of inflammatory pathways, particularly the inhibition of nuclear factor kappa beta transcription factor. So you get all these associated benefits. It's not a miracle drug, but I think it's something to include in your day-to-day strategy because glucosamine synthesis declines as we age, setting us up for some of these things. Putting glucosamine back into your body, to me, is just the most logical thing to do. You do it with other natural and anti-inflammatory agents that don't have side effects that can block cyclooxygenase. It's just, to me, it's a given. So that's my presentation. I thought I'd point out to you that Dr. John Taylor and I are looking at putting on a live full day seminar. We've had a request for this from a lot of people who attended our last seminar. And it's going to be sponsored by the Niagara Chiropractic Society. We're looking at May 1st. And the seminar title is Chiropractic Perspectives on Healthy Aging Naturally, Imaging, Nutrition, Lifestyle Medicine, Chiropractic Care. It's going to be a really great seminar. It's always fun to work with John. I thought I'd let you know. Look for that announcement. We'll send it to you so you know that it's happening in case you want to attend. So on that note, I will say thank you very much for attending. I really appreciate it. Hope this was helpful. I'll get you a copy of these slides sent to you within the next couple of days so you can review these at your own time.